Hi, today we're going to demonstrate how to give a care for patient who has a nasogastric tube institute. Few equipment we need. Firstly, for personal protective equipment, we need non-steroid gloves, plastic apron, goggles. For retaping, we need adhesive tape. For aspiration and confirming placement of tube, we need stethoscope, emesis basin, pH indicator strips, catheter tip irrigation 50 ml syringe. And for suctioning, because we don't have lower suction device in here, we just pretend higher suction as a lower suction device. Also, we need saline sun tube and connector and collecting bag for free drainage. And this is for nostril and mouth grab.
Before we start the procedure, we need to introduce ourselves and verify the patient's identity.
Hello, Mr. Sanders. My name is Jiyeon. I'm an RN looking after you today. Can you please recite your name and date of birth?
And we need to tell the patient what this is for, what you're going to do, and how he can cooperate.
Mr. Sanders, because you got bleeding from your peptic ulcer, I'm going to give you care for nasogastric tube today.
We need to perform hand hygiene and personal protective equipment such as non-steroid gloves and goggles and apron. And we need to secure the patient privacy. Now we need to change the patient position to semi-flawless or any appropriate position to clinical condition if it's not possible.
Mr. Sanders, I will just sit you up a little.
The semi-flawless position contributes to effective suctioning and preventing reflux, which could cause aspiration of gastric contents because the tube does not lie against the wall of the stomach. Alright, for the nostrils and oral care, we need to inspect both nostrils if there are any obstructions and if it's clean enough. With the cotton tip applicators and water, clean the patient's nostrils as needed and apply ointments to ensure patient comfort. In addition, you need to provide mouth care as needed or at least every 2 to 4 hours to maintain the moisture of the oral mucous membrane. For the retyping, firstly inspect the length of the tube or the markings, and it should be done at least once per shift. Prepare type which one end of the place of type is split, forming 2 narrow strips, and the opposite end is left intact. Hold the tube safely while taking off the existing type carefully. The wider intact end of the tape is applied to the nose, and the narrow strips are wound around the tube in opposite directions to secure the nasogastric tube. I'm going to show you how to check the position of tube if it's placed in the right destination. There are two methods we can use for this. One of them is aspiration. To confirm the tube is in the position, aspirate tube to check gastric contents and test it by using the pH indicator strips with 0.5 gradation. For doing this, you need to take the gastric contents out of it by the syringe and pour it in the cup. Dip the indicator inside. And check the colors to see the levels. The pH should be less or equal to 5 for the patients who do not take gastric acid suppression medication. And when the tube is in the respiratory tract, the pH is measured at 7 or greater. Another method is auscultation. To auscultate the stomach, you need to insert the air into the tube with the syringe. Now we can hear the swish of air when you put your stethoscopes off the stomach just below the xiphoid process. If you're sure that the tube is in the right place, you're ready for the suction now. We need to connect the appropriate suction regulator to the wall suction outlet and the collecting device to the regulator for setting. There are two ways of suctioning, which are high and lower sections. Higher section is adjusted up to 400 mm mercury and is largely utilized for temporary large volume or high pressure suction such as an airway suction or unblocking obstructed drain, where lower section is usually up to 180 mm mercury and it is suitable for continuous suction drainage. It's commonly used at the pressure of 40 mm mercury approximately. So we are using lower section in a way of intermittent and free drainage. Generally, intermittent suction regulators are performed with single lumen tubes for a set interval 15 to 60 seconds, followed by an interval of no suction. It is set at 80 to 100 mm mercury or as ordered by the primary care provider. For continuous suction, it is to let the gastric content suction continuously by setting the regulator at 60 to 120 mm mercury or as ordered by the primary care provider. Continuous suction regulators are performed with double lumen, which is suction sump nasogastric tubes. To check the suction is well set up, you need to firstly turn it on. And occlude the drainage tube and observe the regulator dial during a suction cycle to check the level. Also, listen for a sucking noise from the open end of the suction tube or block it with your thumb. To demonstrate the gastric suction, using the connector to connect the gastrointestinal tube to the tubing from the suction.
As we are demonstrating intermittent suction, the interval is 15 to 60 seconds. So after that time, we need to ensure to observe the tubing until the gastric contents emerge and run into the receptacle. So after that time, we can turn off. To prevent fall below the suction bottle, coil and pin the tubing to the patient's gown. do this because the suction may be hindered to push down the fluid down due to the gravity. Check the drainage by observing the amount, odor, color, and consistency. Normal gastric drainage has a consistency like mucus and is either colorless or yellow-green where it contains bile. Bleeding is often indicated with a coffee ground color. If more drainage is necessary, we use this bag for free drainage. Ensure to place the bag lower level of the patient to allow the drain freely by using gravity. So we disconnect the tube and we connect it. After the procedure, ensure all necessary information is documented, such as name of the patient, date and time, type and size of the tube, external length of the tube, incidence of vomiting, the pH level, distension of abdomen, and description of drainage.